Um, and how do I pronounce your first name? Is it Elise?
Alicia.
Alicia, okay. So Alicia, tell us a little bit about what your where your path to where you are now, your background, your education. I know you've kind of had a long, winding path to where you are. So you want to talk about that?
Sure. My name is Dr. Alicia Cyprian, and I actually reside in Louisiana, and I'm a Louisiana native. See, and actually, Jonique and I are relatives, very close relatives. So it's an opportunity, a great opportunity to be here today. So my educational background, I'll do that first, and it really is in education. So I received my undergraduate degree from the University of Massachusetts in political science. And as a college student, a very active college student, I actually started working in the Office of Undergraduate Admissions. So that began my career in education, working as a admissions counselor, recruiting individuals to attend the university. So I spent the next 20 years after obtaining my master's degree in education and then a PhD in educational administration in higher education, working in enrollment management, working as an enrollment management is still recruiting. Then I became a dean of students and oversaw lots of different programs, all related to activities outside of the academic environment at a college or a university, and then worked in the business, was recruited to work in the business office, of which, other than my coursework and balancing my checkbook, I knew absolutely nothing about, but was willing to take on that challenge and learned a lot in business and finance. And after 20 years in higher education, I was actually recruited to come and work in healthcare, which was very interesting because outside of supervising the student health center on campus and the counseling office on campus, did not have any direct knowledge of billing practices and HIPAA. I was accustomed to working within the FERPA environment in K-12. So I've now spent 6 years working in healthcare and have used a lot of my training and knowledge from higher education and the healthcare arena. And I think what has really helped with that transition is that in education, I've always worked at colleges and universities and working to ensure that underrepresented individuals had access to receive a college education. And likewise, in healthcare, I work in community health, where I work with underinsured, uninsured, and underprivileged populations to ensure that they can gain access to preventive healthcare services.
Okay, and could you talk, I know you mentioned HIPAA, I'm sure probably Mr. Weiss students know what that means, HIPAA and FERPA, what that is.
Oh, FERPA is the Educational Rights and Privacy Act, and FERPA really protects the student academic record within the college campus. So there's certain information that you can and cannot share with others. So it's protected information. So you can only give basic information about students in the higher education context. So the grades, the mailing address, the date of birth, all of that is protected information that without the student's consent, you cannot share. And likewise with HIPAA, it's the Health Insurance Probability and Accountability Act, which means that the patient's, again, name, date of birth, social security number, and all of their medical records are confidential, and healthcare facilities are not allowed to share any of that information without the patient's consent.
Okay. And then when you were in college, did you do any sort of internships? Like, why did you pick this career? Did you have an internship or an experience that led you to where you are now?
Well, as an undergrad, I was a political science major. So my internship was really campaigning with whomever the gubernatorial candidate was that year. So my internship was essentially going into the community and getting the community's opinions about that candidate. So for me, I've always worked what I consider in a helping profession, whether it was with advocacy efforts at all levels, whether it be in educating the community about policies and information that would benefit them, and then actually working in education. I really, because I was so active in college, I think I caught the attention of the admissions office, because if there was something going on, I was in the middle, always with a mic in my hand, always wanting to participate and just be totally engaged in what was going on. And once I finished my doctoral coursework, I took a lot of strategy and methodology courses, and that really lended to colleagues who I work with outside of education asking me to come and present, particularly oversee strategic planning efforts for community health centers or other organizations. So I was actually recruited to come and work in healthcare and was really hesitant about coming to work. But after I had done some consulting work for a couple years with healthcare organizations, the board of directors at the organization where I am now saw that and believed that our health center could thrive if we had strong administrative leadership at the helm. So that's how I ended up where I have been for the past 6 years. And it has been a wonderful experience, particularly now as we're dealing with the COVID-19 pandemic, being able to share educational resources with respect to healthcare and how to treat, prevent, and diagnose COVID-19, particularly in rural areas. I live in a very rural area where there are a lot of barriers to access to care and social determinants of health, meaning that people don't have transportation to get to health centers to receive care or testing. People don't have sufficient opportunity to be able to get to the grocery stores to buy healthy foods, and then the stores that are near them do not have healthy foods that they can purchase. People don't have access sometimes to adequate housing. So it's really good to be in that environment, to be able to work with a group of colleagues to provide that information in a lot of modes to the communities.
Great. And so what you said your community health, it's a community health. Is it a hospital or do they have outpatient and inpatient? If surgeries happen, what happens in your?
It's only an outpatient clinic. So we're a federally qualified health center, and we're funded through the Health Resources and Services Administration in Washington, D.C. to provide care to mostly rural populations, but we call FQHCs, but we exist. There's over 1,400 FQHCs across the United States and in other countries as well.
Does that mean, you said it's federally funded?
Yes.
And is this where the uninsured go, or both insured, underinsured, or?
We take both uninsured. We also take those who are on Medicare and Medicaid, and any individual who has private insurance. Blue Cross, Blue Shield, Aetna. So we take all patients, but we are specially funded to provide access to care for those who otherwise wouldn't have the opportunity to receive preventive health care.
So you mentioned transportation. Is that something that you have power of, like maybe hiring bus drivers and buses to go pick up your patients and bring them to where you are to get treated?
Absolutely. We actually have 3 transportation vans. And so we have 3 full-time transportation drivers who will go and get patients from where they live, bring the patients to their appointments, and take the patients back to their home. We also deliver prescription medications to patients utilizing our transportation services as well.
I would think that makes a big difference for your community where you live. You said they're kind of spread out, and a lot of older seniors don't have access to healthcare in a lot of rural areas.
It makes a huge difference that we don't have public transportation. So we become the transportation, and Medicaid does provide transportation. However, when you utilize Medicaid transportation, there's no set time of when the transportation driver is going to come back and get the patient from their visit to bring them back home. So we've had times in our clinics where we've had patients to sit there prior to our getting transportation. That's what really motivated us to be able to provide that access to patients so they can get to care. And then once care is delivered to them, they can get back to their residence.
And is your facility able to treat emergencies, or is it just preventative and kind of outpatient?
It's outpatient, but we do emergency visits as well. So we do emergency visits for primary care, for behavioral health care, mental health, as well as for oral health care, dentistry. So we do have emergency visits, and we also are required as a federally qualified health center to have walk-in or same-day appointments. So if somebody is just really not feeling well, we have blocks in the morning and blocks in the afternoon on our schedule for individuals who don't have appointments but are in need of care, particularly those who wouldn't be able to go somewhere else for care. And we try to encourage the community not to go to the emergency room, because we want to be able to provide continuity of care, so to treat them and then to monitor and work with them to ensure that whatever chief complaint they have, that whatever is going on with them, we can help them to resolve it and not just a temporary fix until that issue comes up again for the patient.
Okay. And then kind of what is your work life? What are your hours? Do you work Monday through Friday or no? Do you have a typical work day and hours?
So as a chief executive officer, really, there is no typical day. The last 2.5 months have been the most atypical of my entire career. March the 13th will be forever etched in my memory, because normally, pre-COVID-19, my days start at 7, sometimes even 5:30 in the morning, and more than likely don't end until the afternoon. Being as part of the C-suite, which is the chief suite, you spend most of your day in meetings. So just as I was being called by Ms. Burton, I had just ended a meeting call, and that was the 4th meeting call since 8:30 this morning. So most of the day is spent in meetings, and the evenings are spent responding to email, because as the person who has charge of the organization, I want to make sure that my response time is timely, because you have to inspect what you expect. So I have to lead by example, and I do that, and I have this communication that I send out to all of our employees as well as our board of directors that's called Southeast in the Know. Because if you're in the know, then you don't have excuses for being able to get your work done, because the community is depending on what we are doing. So the fact that I have to ensure that I am leading by example requires that my days during the week are long, and even during the weekends. So I often, in some organizations, particularly for grant writing and things of that nature, will hire individuals and contract with them to do that work. I write all of our grant applications only because I have the ability to do it. 1, 2, it saves us money, and 3, who else can tell the story better than I can, because I live it and am engrossed in it every day. So there is no really a typical day. I honestly work 7 days a week. I do work-life balance a lot, even though COVID-19 has placed a lot of us working remotely. There's not been a big change for me, because when there's time that I need to work remotely and be in a quiet place, I don't go in the office. I will often work from my home office to be able to get my work done. So it's just having a good relationship with your supervisor or supervisors. I have 10 immediate supervisors with whom I work, and being able to develop that reputation so that they know, it doesn't matter where you are, that your work is being done and your quality of work that you're producing is good and represents them and the organization well.
Mm-hmm. So you work with a lot of people, so you don't have any kind of direct patient contact usually. It's being part of the decision-making process about providing care?
Correct. I am not a provider. So I am an administrator. But I am one of the individuals, along with the chief medical officer, that reviews all patient complaints. So patient complaints come to me. I often talk to patients, and I tell people all the time, there's advantages and disadvantages to living in the community where the service is provided. So I live in one of the communities where services are provided. So a lot of people know who I am. So if there are patients who really need to get on the schedule and feel like they're not being accommodated appropriately, they'll call me. I'll get knocks on my door. during the weekend. So while I do not provide direct patient care, I have a lot of communication with patients with whom the health center serves.
So are you approached in the grocery store and that kind of thing sometimes? With
Every church, everywhere. I'll never, in November, we moved to a new church, and our organization was issuing refund checks for overpayments to patients. And I had a church member come to me and she said, "You signed this check. Is it good?"
Okay.
Yeah, it's good.
Wow. What are the typical complaints that people are posting or submitting?
Mostly it's the wait time. Once they check in at the registration desk to be called back into the exam room. Sometimes patients will complain about the care that they receive from the provider, especially if they don't feel like the provider is concerned or engaged and listening to what they're having to say. They'll complain about that as well. Mostly, though, it's really about the wait time, either to get an appointment or when they get to the clinic, when they check in, being called back to the back to be seen by the provider.
And then, with patients, so do you have, you said you had mental health services, you have like general practitioners and that kind of thing. Do you see any kind of pressure? I see it over here sometimes where the doctors are being told to see a lot of patients in a short period of time.
We don't. We have productivity requirement because the federal government, we're funded by the federal government, so they give us a portion of our revenue, but the remainder of our revenue really comes from billing, being able to bill the insurance companies to collect money to operate outside of being able to pay the providers. And we have all of our providers are contracted employees, and they have productivity standards, but we understand that depending on the need from the communities, and though the data shows that there's a great need, that they may not be able to meet those productivity requirements. And it really depends on the provider. I have learned, and regardless of profession, individuals are just that. People are people, regardless of their credentials and the work that they do. So getting to know who people are as individuals will help guide conversations. I've had to have conversations with providers about their productivity, particularly within the last 8 to 10 weeks, because we have gone from an environment in healthcare where everyone was coming into care for clinic, and now the same way in which we're having this Zoom call, we are having the same appointment types with our patients, and some providers are really not comfortable with delivering care in this method. Hehowever, we've also seen 50% of our patient volume reduced because individuals are afraid to come into healthcare environments because they really believe that the virus lives in the health clinic. So actually letting our providers know that our patients need us and we need to reach them. And though right now it may feel somewhat uncomfortable, this is what we need to do. And we're all going to have to rise to the occasion because we need to continue to meet the mission and vision of the organization. And that resides in providing care to our communities who otherwise don't have access.
So speaking of COVID, are you doing telemedicine? They call it telemedicine, and doing Zoom calls with patients. Is that what providers are doing, the doctors?
Right, but we're not utilizing Zoom. In healthcare, we have a system called an electronic health record. So inside of our electronic health record, there's software that does video calls with our patients. So we use that software to utilize and do. So we do telehealth, so we have 3 telehealth services. So we do telemedicine, which is the primary care. So if somebody has a headache or cold, we'll provide that care. We do telebehavioral health. So if anybody is having anxiety, they're stressed, we do that kind of telehealth. And we also do teledentistry. So if somebody has an abscess on their tooth, that they have a swollen mouth, the software is so robust that if an individual is utilizing a cell phone to do that service, they can put the cell phone up to the infected area in their mouth, and our provider is able to provide initial treatment. And then if it's deemed an emergency, because we do emergency dental services even now, we're able to put that individual on the schedule after they finish that antibiotic and get them for the care that they need.
Okay, and do you see a difference? You said you did see a difference with people kind of scared to come in. Are you treating COVID patients at all, or people that might be, I'm sure they're getting tested or some way, shape, or form on the way in with their temperature or some kind of protocols, right?
Yes, so we do temperature check everyone, even employees that enter our facilities. And yes, we are testing and treating COVID patients, including our employees. We've had 5 employees who have tested positive for COVID-19, and we're actually ramping up our community testing right now. We have a mobile unit. So we have a clinic on wheels, as we call it. So we're taking that clinic into the most rural areas where we provide care, and we are testing anyone, because they've not received any testing. Anyone who wishes to have a test, we're testing them. There is no charge for the test. And because we're a federally qualified health center, regardless to the test result, we are still providing counseling and education. And if the test comes back positive, we're also providing, though there's no treatment except, the Tylenol if you're not feeling well, and to stay hydrated if you have a temperature, and to stay hydrated, we still are providing and following up with those patients and working to utilize contact tracing to help them to identify those who they've been in contact with 2 days prior to them first getting ill, to help to slow the spread.
Let me actually ask you about the contact tracing, because I have an app called Citizen. I don't know if you're aware, but they keep track of accidents and, police being called of various things. Now they've also did a contact tracing thing where you can put in if you have any symptoms today. And I know some other countries, because we're big on privacy, other countries are not giving their citizens privacy, and they want to know who has it, who you've been talking to, who you've been spending time with. What are your feelings on that, keeping track of who has it and where they are?
I think it's important, but you're absolutely right. The call that I was on before this one, that's exactly what we were talking about. And I was telling them that I was on Facebook maybe 2 days ago, and that's exactly the message that I saw from one of my Facebook friends saying, you do not have my permission to utilize my Facebook account or my phone number to trace my whereabouts to know where I am. So there's a great divide on whether or not to allow contact tracing. In Louisiana. It's optional. So if someone tested positive and a contact tracer contacts them to ask and want to inquire about where they were, who they've been around, they have the right to say, I don't want to divulge that information, and there's nothing else that can be done.
Yeah, because I'm just wondering if it's even a good idea to say, oh, no, I don't, because right now, no, I don't have symptoms. No, I don't have, but what if I have symptoms? What happens out of information where it goes out into the universe?
Right, and the thing though about, and we've heard this from the CDC, about 35% of the population are COVID positive, and because they're asymptomatic, they don't have any symptoms, so you really don't know. And that's why, and so then that leads us to the other divide on face covering, no face covering. So that's become like really big, in the US regarding COVID-19.
Do you recommend that people that don't have any symptoms, do you recommend, what is your opinion on testing? Should everybody get tested regardless of their symptoms or not?
I believe they should. However, getting tested does not mean that if you're tested this week and you're negative, next week you may be positive. So it's without a vaccine, it's really difficult. But if someone, wants to know, am I positive right now, then they can. I think once the antibody test and there's some question about the validity and reliability of it, but once that's more pronounced and available, I think individuals will be better served in knowing. And, and again, even with the vaccine, they're working on, getting a vaccine and early early of next year. But again, the question lends itself, is that vaccine going to prevent you from contracting COVID-19? So there's just a lot of unknowns, and like the CDC and everyone else, I think, we're still learning because this virus is like, it's novel, it's not existed before. So learning with some uncertainty, and we're learning more, but we're not there yet.
Right. Getting back to like hospital administration, we do have students and who are going to be watching this who are thinking about career medicine. What are like some main differences between a hospital or a healthcare center administrator versus a provider? Like what are the big differences?
Sure. As a provider, the providers have the direct hands-on care with the patient. So they are helping the patient in understanding their plan of care. So the patient will come in, they'll talk to the provider will treat them for whatever their chief complaint is when they come in, and then they'll schedule follow-up visits if necessary. And the provider's role is to provide continuity of care for those individuals. As an administrator, the lens is much broader. You have the responsibility and knowledge not to know exactly what goes on with the provider visit, but to ensure that all lines of business, your finance area, your human resources area, your operations, that make sure all of your facilities are in order, to make sure that even your clinical area is what it needs to be, and that your providers have the appropriate licensures and certifications that they need in order to practice in the discipline in which they practice, as well as ensuring that, with human resources, with hiring. So it's everything that the organization has responsibility for in an administrative role that you'll be responsible for. And in most in community health center settings, definitely you are the signature authority for all information, and that includes insurance contracts in which you don't have direct hands-on care, but the responsibility is yours as the person who has oversight of the facility. Mm-hmm.
So what would you say you love the best about being an administrator?
Seeing employees engaged in the work that they do, and just the scope of work that a community health center does, being able to provide an opportunity for access to individuals who otherwise wouldn't have that access, and working with a team of colleagues, particularly at the leadership level, who care, who give it their all. Our emergency preparedness and crisis planning team was activated on March the 13th, and it's still activated, and we worked probably 30 days straight, including the weekends, because we knew what it meant for us to be able to adapt to the environment that was going on at that time and continue with provision of care to the extent that we could to the communities that we serve.
Right, and so it seems like it would be rewarding at some point.
It is.
Yeah, right. And then what about the things that you just dislike the most about your role?
Sometimes, especially working in healthcare, not being a provider, you sometimes have to let providers know, because there'll be times when there'll be conversations and a provider will say, well, that's my patient. And I'll have to say, I understand that you're providing the care, but that's the health center's patient. So understanding, if you don't have, because I didn't have a healthcare background, I didn't have a public health background, though I was familiar with those areas. So it was really being able to gain the trust and the confidence of the providers, because I had done business and finance, work with HR a lot. So it was the medical component in embracing and working with them for trust. And then once that was built, then that challenge was overcome. And additionally, it's really with working to ensure that you're being reimbursed. So sometimes it's challenging working with the payers, who are the insurance companies, and saying, wait, we provide this level of care, we're not understanding why we're getting this reimbursement. So those are two of the challenges that, especially when you have a new provider that onboards, who has to get to know who you are, because you are not a clinician working in the healthcare environment.
So with students, again, taking sports therapy and sports medicine, and we have that medical pathway at our high school, what would you recommend? Because they're thinking about, okay, what career do I want to go into? Is there a better personality or skill set that is better suited towards administration versus providing care?
I don't believe, we have a chief medical officer who owned a private practice for 20 years before we purchased her private practice, and she began working full-time for us. So it's just really about, the intrinsic value of what the person wants to do. Again, as I shared, as an undergrad, I was outgoing. So I have no problem doing interviews, getting in front of hundreds and thousands of people and having conversations. So it really depends on the individual and where they see they're best suited, and what kind of workforce, what kind of career in that workforce will be best suited for them.
Mm-hmm. And then starting out in hospital, I know that we have some state schools that offer hospital administration as a bachelor's degree, sometimes a master's degree. Is there a salary range at all? I know being in Louisiana is a little bit different than California, but about the salary scale, do you have any?
It depends on the position. So typically an entry level position for individuals who are going into maybe a chief operating officer role or coordinator role, typically would be $40,000 to $60,000. So probably in California, I don't even know what the difference in wages are, but in Louisiana, it would be between $40,000 and $60,000. Once the experience is attained, then that is easily a six-figure salary at the leadership role. And it really depends on the system. If it's a small system, then the salaries are not going to be as great as a larger system that's going to have a lot more responsibility attached to it.
Right. And so is this something that you could do out of a 4-year degree? I know you have a doctorate, but can you do this out of college after a 4 years?
Absolutely. And there are a lot of, outside of baccalaureate degree programs, there are a lot of executive leadership or executive management programs that, particularly in healthcare, that I see lots of individuals attain in addition to the baccalaureate degree. So there are a lot of, particularly in community healthcare, a lot of individuals whose backgrounds are varied. I've seen individuals with bachelor's degrees. I've seen them with MDs. I've seen them, with psychologists, social worker background. So it really just depends on the individual, and sometimes regardless of credential, just the intrinsic value and motivation.
So they don't have to necessarily get a degree in hospital administration?
Absolutely not. But it adds a lot of context, though, to the work, so that the transition from the coursework to the environment is not so convoluted. It does help ease the transition a great deal, because they'll understand, again, all of the verbiage and the modeling and how those environments, especially in healthcare, work.
Right. And I know that there are some big I don't know if you have Kaiser out there, but Kaiser has a En-ROADS program for college students. That's an internship program and a paid internship program for college students. So anytime they do internships in a field, it's a great experience for them that could lead to their first job out of college. So
absolutely. And I encourage paid and unpaid internships, because the unpaid internship also goes on your resume, and that adds credence. So not only do you have the educational background, you now have some experience in a healthcare environment that could make a difference between someone who's graduating and applying for a job without that internship experience on the resume.
Yes, and we have actually a virtual one that I got to our teacher. We have a virtual a health immersion program with medical speakers and research and that kind of thing. So it's great to have that opportunity, I know. All right, anything else you want to add about your career that we haven't already covered that you want to tell students about?
So I'll just tell students, this is my second career. So I'll just share with the students, just follow your heart, follow your passion. Don't pursue a career for money, because money is a short-term reward that doesn't last. But if you enjoy what you're doing, particularly when it gets difficult, like right now in healthcare, it's very difficult, but my energy and my commitment is greater now than it has ever been. So pursue a career based on what makes you happy, and you're able to wake up every day, to the extent that you can, motivated about going to do the work that you do, because you are making a difference if you have that mindset.
That's great advice. I think, yeah, I know money is great, but we've had plenty, I've heard of plenty of CEOs and business owners that just go back and they want to be a teacher or something.
Right.
They want to get some fulfillment and have a rewarding career. So don't follow the money, follow your passion. Yeah.
Absolutely.
All right. Well, thank you so much for coming on and sharing your experience and wealth of knowledge with us today.
Thank you so much. I wish you and the students much success, especially as your school systems begin to develop how the learning will look when school resumes. So best wishes to you. Students, regardless of the environment in which you go, make the best of it. You are our future, and I have no doubt that you will do well.
Yes, thank you. I think this is the future of the Zooms, and I'm so glad we can pull from people all over the country in these times to share their knowledge. So again, appreciate your time. Thank you so much and have a great afternoon.
Absolutely. You too. It's been a pleasure. Take care.
Okay, bye-bye. Bye, everybody.
Bye-bye.